effect of combined exercise on exercise adherences and health self-efficacy in middle-aged women. Dr. Ryewon. Introduction. Middle-aged women who are located between maturity and old age during the development stages of life experience changes in the role of the family, the social support system, and individuality in society, as well as physical ones such as aging and the onset of physical illness, and to adapt to various changes in socio-psychological factors such as loss of relationship. Menopause, which is experienced by middle-aged women, may cause various physical and mental changes, thus, unless directly managed, making them vulnerable to many types of diseases. In addition, considering that the health of this period affects the quality of life of the elderly, the importance of health care is also emphasized. The regular exercise is an appropriate stimulus for the body, promoting physical health, such as the maintenance of daily activities and reducing depression or stress in the aspects of psychological health. Exercise also has social effects such as a decrease in health expenditure and increase in social participation, as well as an improvement of well-being, inducing higher motivation for life. Since the exercise in middle-aged women has a close relationship with lifestyle and plays an important role in improving the quality of life, it is important in exercise selection to choose an exercise that reflects various conditions such as the types and environmental condition of exercise and subjects' willingness to participate in exercise. The combined exercise is carried out in various ways, using tools that help increase exercise capacity, such as aerobic and resistance ones. This type of exercise has effect of reducing the metabolic syndrome factors, strengthening cardiorespiratory fitness, and reducing cardiovascular risk factors, which are making this type of exercise to be a theme of extensive studies. Even though the importance of exercise effects is accepted widely, the continuous participation in exercise is so difficult that it is likely to stop exercise even before checking the effect of exercise. This means that the continuous and active participation in the chosen exercise according to one's needs is very important. The health self-efficacy is perceived one's ability to perform tasks related to physical performance for health promotion and is an important variable in sustaining exercise behavior. Although the importance of exercise as a means of health management in middle-aged women has been emphasized, research on the development and effects of exercise programs that increase their willingness to participate actively and continuously in these exercise programs has been very limited. The purpose of this study was therefore to develop a combined exercise program to induce the participation of middle-aged women and to examine the effects of the participation in the proposed program on the health self-efficacy and exercise adherences. This study also intended to provide basic data on the development of effective exercise programs for the continuous health care of middle-aged women. Method. The subjects of this study were 20 middle-aged women aged 35 to 65 who participated in a combined exercise program administered by the S District Public Health Center in Busan Metropolitan City. The contents and procedures of the exercises were explained in detail, and the consents were acquired before enrollment in the study. The data were collected for about 3 months from 4th September to 29th November 2017. This one group pre-post experimental study intended to investigate the effects of 12 weeks combined exercise program on health self-efficacy and exercise adherence in middle-aged women. The general characteristics, health self-efficacy, and exercise adherence were pre-measured 1 week before the exercise program and post-measurement was performed over the last week of the exercise program. To minimize the effects of extraneous variables on the results of this study, nutritional counseling was added during the program to instruct them to keep their eating habits unchanged during program period and encourage them not to participate in additional exercise. Health self-efficacy. The self-related abilities for health practice scale translated, modified, and refined by Choi was used. This instrument is composed of 28 items, and the higher scores indicate higher level of health self-efficacy. Exercise adherences. The willingness to adhere exercise Korean version developed by Choi was used. The tool consists of 17 items and measures 5 subscale of exercise ability, exercise habits, exercise environment, exercise interest, and exercise friend. The higher score indicates the higher level of direct participation or adherence without stopping. Combined exercise intervention. A total of 4 specialists, including a doctor specialized in physical education, an exercise prescription specialist, 1 social work practitioner, and a doctor specialized in adult nursing participated in the development of the proposed program. The stretching as a warm-up and cool-down exercise before and after main exercise was added. The main exercises include aerobic exercise, body exercise, stretching, step box, low-middle intensity exercise, core exercise, TheraBand, kettlebell, and flexibility and balance exercise yoga. The program consisted of 3 sessions per week for 12 weeks, and it takes about 60 minutes in completing a session. Statistics. The collected data were analyzed using SPSS 23 program. The pre- and post-program mean and standard deviations of the subject's health self-efficacy and self-adherence were used in the level of the corresponding variables. The Wilcoxon signed rank test was conducted to test the ranks of pre- and post-exam experimental effect. Conclusion. In this study, the effects of 12 weeks combined exercise on health self-efficacy and willingness to exercise adherence in middle-aged women. The results showed significant increase in nutritional efficacy, a subscale of health self-efficacy after program for the exercise adherence, the total score as well as subscale of exercise habit and exercise interest increased significantly after program. The exercise plays a very important role in improving the quality of life in all age groups. This exercise is more important in middle-aged women because they are subjected to various physical and psychological diseases due to menopause in the course of transition to elderly. Although the effects of exercise may be improved through manipulating the intensity, The number of times is more emphasized than the intensity. The willingness to participate in and interest of exercise are also important factors. The combined exercise applied in this study resulted in the increase in willingness of exercise adherence in middle-aged women. However, failed in improving the health self-efficacy on exercise. It is urgent to provide a program that induces others to participate actively and self-directly in the exercise and lead healthy life by themselves. The future research are recommended to investigate the effects of exercise widely by adding physical variables. This study was funded by the research grants for new professors of Gyeongnam University.